My name is Lindsay Baker, and I'm a registered dietitian, certified diabetes educator, and intuitive eating counselor with a private practice in Cranston, Rhode Island. I use a non-diet, intuitive eating and health at every size approach to apply medical nutrition therapy and nutrition counseling to my clients in a safe and comfortable environment. The clients that I work with are in their teens through late adulthood. The clients are often confused about nutrition misinformation. They're struggling with chronic dieting, disordered eating, and eating disorders. And many of these clients are also struggling with these types of disorders on top of maybe one or two or more medical diagnoses that have appeared in their life either recently or in the past. And so they're really looking for help in not only managing disordered eating, if that's something they're struggling with, but also a recent or long occurring medical diagnosis. As a certified diabetes educator, I work with individuals that have been recently diagnosed with type 1, type 2, or gestational diabetes. I also work with individuals that have been managing diabetes for much of their life. When an individual receives a new medical diagnosis, this often comes with an expectation of food and or calorie restriction, and also a tremendous amount of nutrition advice from well-meaning friends, family members, and also media. However, we know that rules and restriction with eating most oftentimes makes health outcomes worse and further triggers disordered eating in the future. Instead of rules and restriction, I use intuitive eating and evidence-based nutrition information to guide clients towards making peace with food and sustainable changes in food and movement that feel good to their body and soul. This process is individualized to each person and oftentimes involves us exploring one's current and past relationships with food and body image.